All right, let's dive right in. We're going to tackle a really tough question today when it comes to health education. Where exactly is that line between helping someone and, well, controlling them? You'll see it's a lot blurrier than you might think.
So let's start with something you might have even seen yourself. Imagine your job offers you a cash bonus for hitting 10,000 steps a day, and all you have to do is let them track it with a fitness app. Is that a great, healthy incentive, or is it a huge invasion of your privacy?
I mean, on the one hand, the upsides seem pretty obvious, right? A healthier team, maybe lower insurance costs for everyone. But on the other hand, you've got to wonder, where does all that data actually go? And does it create this weird, unfair pressure on people who can't or don't want to participate? This one example, it really opens up a much, much deeper conflict.
And here's the thing. While that fitness app is pretty new, this debate is anything but. This is a fundamental tension that public health professionals have been wrestling with for a long, long time.
So, to really get a handle on the ethical puzzles we're facing today, we actually need to go back in time. We're going to zero in on a key moment that basically defined this entire debate. Our main piece of evidence today is an academic article from 1993. Yeah, we're pretty much going to unbox a time capsule of public health thinking to find the roots of the arguments we're still having right now. The title of the paper, Ethical Issues in Health Education and Health Promotion. Now, what's so wild is that it sounds like it could have been written this morning, and that just proves how timeless these challenges really are.
Okay, so let's get the basic facts down. The author is Kenneth McLeroy. The year, like I said, is 1993, and it was published in the Journal of Health Education.
And get this isn't some dusty, forgotten paper just sitting on a shelf. Its author, Kenneth McLeroy, has been cited by other researchers almost 10,000 times. A number that big tells you everything you need to know. His work has had a massive, lasting impact on this entire field. So the most important point is hiding in plain sight, right there in the title. McLeroy's entire argument really hinges on the critical difference between two key ideas, health education and health promotion. They sound similar, but they are worlds apart.
First up, you've got health education. Now, this is the simple part. It's really just about giving people information, the facts, the science, the risks, the benefits, and then you step back. You trust them to make their own informed choices.
But then you have health promotion, and this is where it all gets messy. This isn't just about informing anymore. This is about actively persuading and motivating people to change what they do, to adopt a very specific behavior.
And that right there, that is the heart of the entire ethical dilemma. That little gap between just informing someone and actively trying to persuade them, that's the ethical minefield. It's where every single one of these tough questions comes from. So, how does this all play out in the real world? Well, for doctors, nurses, and public health officials, this isn't some abstract idea. It's their daily reality. It's a constant dilemma.
They're asking these questions all the time. Where exactly is the line between a helpful, friendly nudge and pressure that starts to feel, well, unfair or even coercive? And here's an even bigger one. Who gets to decide what healthy even means for an entire community? Is it the government? Is it a panel of medical experts? Or should it be the community itself? Whose values get to be the default?
And maybe the toughest question of all, is it ever okay to use really powerful emotions, like fear or shame, to get people to change their ways, even if you have data that shows it might actually work? And this brings us right back to where we started. That 1993 paper basically predicted it. The specific health topics, they might change over the years, but the fundamental ethical problem, it is exactly the same. You can literally trace this pattern through the decades. Back in the 90s, the big debate was about those super aggressive anti-smoking campaigns. Fast forward to the 2010s, it shifted to things like taxes on sugary drinks. And in the last few years, well, it's been front and center with all the debates over vaccine and mask mandates. See the pattern? It's always this core tension. Individual choice versus the public good.
The technology evolves, the politics shift, the specific issues change. But that core ethical challenge that Kenneth McLeroy laid out so clearly more than 30 years ago, it's more relevant and more powerful today than it has ever been.
And that leaves us with one final, really important thought to chew on. As we head into a future of AI health coaches and predictive big data, what's the next ethical frontier going to be? The tech will be brand new, but the question at its heart will be the very same one we've been asking all along.